Hi, welcome to this video on OET Speaking. Now, if you're somebody who is preparing for OET, you would be knowing what the format of OET Speaking is, how much time does it take, and all of those. And speaking is one module which is profession specific. That is, despite the fact that the format, the structure and the time would be same across all the professions, the content, the kind of content that is included in the role play card will be different depending upon each profession. It varies across the 12 different professions. So this video is basically intended to look this role play card from a closer range. Actually, we can do a dissection of this role play card and understand what are the various aspects that are included in the role play card and what facts we should be careful about, what are the aspects that students generally tend to overlook. We'll do an analysis. Okay, now let's begin. You can see a sample role play card on the screen. It'll be always better for your understanding when I relate and explain it with the support of an example. Okay, so this is how a role play card will appear, as you can see on the screen. Now you can see some headings, side headings like setting, then another subheading as nurse. So this role play card is for nurses, so it has this subheading nurse here. Then if it's for doctors, it will be medicine. Then for pharmacists, it will be pharmacist. So according to the profession, it varies. Then you have this subheading as task, and there are a lot of bullet points under that. Now students, what they do is that, as you know, you have to perform 2 role plays for your speaking test. You have to perform 2 role plays, and each of which will last for 5 minutes. And for each role play card, you will get 3 minutes to prepare. And 3 minutes you prepare on the role play card, during which you are allowed to make notes on the role play card. And if you have any doubts regarding the role play, that is, if you're not very familiar with a particular word in the role play card, which you're seeing for the first time, you're free to ask regarding that word, what does it mean, to the interlocutor. If you're not very sure about the pronunciation of a certain word, even that you can check with the interlocutor. All those can be done during that 3 minutes of preparation time. And then you have 5 minutes to speak on that role play card, during which you can retain that role play card with you and you can refer back to the role play card as and when necessary. Now, what students do generally is that immediately as their 3 minutes of preparation time starts, they directly focus on the task. Of course, it is using these tasks that you have to build your conversation. You have to carry forward your conversation using these tasks, that is for sure. But like, why are these setting and this nurse, these 2 aspects, are they just for decorative purpose? Obviously not, right? They'll have some purpose. Now, I would say that from my experience, what I've understood is that students are generally oblivious to these 2 parts. They don't pay attention onto what the setting is and what the scenario is. But it is very important that you understand the setting and the background. I'll tell you why. Let's take one by one and then understand its significance. First, starting off with the setting. Here the setting is given as emergency department triage. Now triage means triage is a place where the patients are prioritized based on the urgency of their medical condition. So you are a nurse in that emergency department triage. Now, why is this setting given here? What is the importance of setting being given in the role play card? Just imagine that. Just imagine yourself as an individual. Now, you go to a party. You meet your friends. Now, the way in which you'll be interacting with them, when you first see them, the way in which you'll be greeting them, how would you greet them? Hey, hi, what's up? It's been a long time. Or let's enjoy, let's chill. Okay, that's the way that you'll start your interaction. But at the same time, like your friend's maybe parent is hospitalized, so you go to meet your friend. Will you be initiating the talk in the same way? Oh, I just came to know about the news from another friend of ours. I'm sorry to hear that. So that's the way. Your voice is different, your tone is different. See, it is the same person, you are the same person, and the person with whom you're interacting is also same. But the way in which you'll be delivering the conversation and the way in which you deliver your dialogue would be different. So setting basically means it gives an idea on the stage on which you're going to showcase this role play. You're going to enact this role play. So setting has an importance or has an implication on how your tone should be. It is very, very important. Now here it is given as emergency department. So in an emergency department, you cannot talk to the patient in a very relaxed way. Hi, how are you feeling? It's been a long time since we have met. No. Is that even logical? No. You have to show that urgency. That urgency should reflect in your tone. So for setting the right tone for your conversation, understanding the setting is very, very important. Now, when it comes to this real scenario, to deliver the right tone, you have to understand the setting, and from the exam point of view, it has an implication on your scores, speaking scores as well. So there is an assessment criterion which is called as the intelligibility. Under the linguistic criteria, there is one criterion which is intelligibility, which is nothing but it is related to this tone, rhythm, the way in which you deliver your the ups and downs, the variations in your tone. So for that reason, to ensure that you score rightly or you score well for intelligibility, you have to make sure that you understand the setting rightly. So the main purpose, what I would say, is that to set the right tone for your conversation, you have to pay careful attention on what the setting is. Not just that, partly it will help you in deciding whether it is a known or an unknown case. Even though not fully, because to understand it fully you'll have to read further. Now, like if it's a home visit, if the setting is given as a home visit, there is a 50% chance that it can be a known case. That is, maybe you would have probably visited the patient before and now you're going for a review. So it's a known case. Now, why do we have to differentiate between this known case and an unknown case? Because the way in which we initiate a conversation, the way in which we introduce, the way in which we greet, it all varies depending on whether it is a known case or unknown case. The way in which you greet a known person will be entirely different from how you greet an unknown person. So partly this setting will tell you whether it is a known case or unknown case. And it is of course decided by other factors as well. The rest of the case, the rest of the role play card will also help you in determining whether it is known or unknown. What the main aspect or the main significance of the setting, what I would say, is that setting the right tone of the conversation. Now, we have it's not just the emergency department, we have a lot of different other settings, like we have home visit, hospital ward, then clinic. All these are different settings. When you have if you have been practicing a lot of role play cards, you would have come across these different settings. So next time when you do the role play card, make sure that you keep in mind what the setting is, and accordingly you have to set the tone of your conversation. Then the next part, I would say, is you will have a section given as nurse. Okay, this is nothing but the background information. It is the background or the scenario. I would say the scenario. Now, what is given here? You are speaking to a 25-year-old patient. The age of the patient is given, who has come to the emergency department with a very bad headache, possible migraine. Over-the-counter medication has been ineffective. Now, when you're going to talk to somebody, if you have an outline regarding that person, the communication becomes easier. So for that reason, it is very important that you get a picture regarding the background or the scenario. Now, this scenario will help you to understand what is the social, then emotional, and physical condition of the patient. Not in all cases you might be able to get these details, but in majority of the cases you will be able to understand these aspects from the scenario or the background information. Now here, when it comes to social, no further details regarding the family and stuff, it's not given here, but of course the age of the patient is given here, 25-year-old patient. Now, is understanding the age of the patient really difficult, is really important? Will it bring about any difference in the way we do our speaking? Of course, yes. The way in which you talk to a 25-year-old will not be the same when you talk to a 75-year-old. You'll be more respectful, you'll be more polite. Now, the same way, if you're talking to a child, again, there'll be variation in your tone. The kind of words that you use will be different. So, it is important that you understand how old is your patient, and that information you get from this scenario or the background details which is given against this subheading nurse. Then, Emotional state of the patient can also be sometimes understood from this background information or the scenario. Sometimes it will be given here. The patient is anxious, the patient is worried, the patient is confused. So you are equipped with that idea. I'm going to meet somebody who is anxious and worried. So accordingly, you will be adjusting your tone. So for that reason, again, this is another reason why you have to read this background information. Now here, no such emotional aspect is not mentioned here, so it's fine. Then also it gives an idea about the physical state of the patient. Now here it is given that the patient has come with a very bad headache, which means that the patient is in intense pain. Now to a person with intense pain, definitely you will not be going and asking how you're feeling today. But it's not necessary that the patient has to express it verbally. You can take cues from the patient. It can be verbal or non-verbal. Seeing the patient uncomfortable, you can initiate the conversation accordingly. So that is why this background information is given here, for you to get an outline of the patient you're going to deal with. So from here, from this specific scenario, you understand that the patient is 25-year-old, okay, not a very elderly person, and neither an elderly person, not a child. Then you understand the physical state of the patient. The patient is having a very bad headache. And then another piece of information given here is that over-the-counter medication has been ineffective. So somewhere in the role play card, a situation will be arising that the patient would be saying to you that I have tried over-the-counter medication, but this pain, this pain is still bothering me, or the pain still persists. Okay. But it's just for you to keep in mind. You have for the candidate to have an understanding of the patient that you're going to deal with. So the reason or the importance of this background information is that, just like how we are seeing, the setting helps you in setting the right tone for the conversation. This background information will help you in initiating the conversation in the right way. That is, students are mostly, what confuses the student, or they are actually panic about how to start the conversation. Once they get the grip, they just follow the task and they're able to carry forward it smoothly. But mostly what I see is that students have this trouble of the last moment, when their 3 minutes of preparation time is about to get over, they ask, is this a known case or unknown case? So what should be the first question that should I be asking the patient? So that how to start it off, that usually confuses the students. Now in this case, one good way of starting the conversation would be, see, you can say that, good afternoon, I'm Roshni, a nurse in the emergency department. May I have your name, please? And then if the patient would reply, if it's John, you can say that, okay, John, you look a bit uncomfortable. Could you please tell me what brought you here today? I'm here to listen and help however I can. Now this is the introduction or the initiation of your conversation. Now when you're initiating your conversation, you have to be careful. What are the things that you need to include while you're initiating the conversation? You have to greet. First of all, you have to greet the patient. Then you have to introduce yourself. And then you have to give an idea about the nature of the conversation. Now, greet means saying hi, hello, good morning, good afternoon, whatever it is. Introduce yourself means you're telling that I am Roshni, or I am so-and-so. I'm one of the registered nurses working in the community health center, or I'm one of the nurses in the emergency department, or whatever. You're introducing yourself. Now, this introduction will not be necessary in all the situations, okay? Now, if it's a hospital ward and you have been visiting that patient daily, and on the day of the discharge, you're going to meet the patient to give the discharge details, again, you don't have to introduce yourself and say that I'm Roshni, I'm one of the registered nurses working in this hospital. No, because you already have an acquaintance with the patient. So that also you need to understand. Other than that, generally, these are the aspects that you need to include in the initiation. You have to greet, hi, hello, good morning, good evening, whatever it is. Then introduce yourself and then give a hint to the patient about the nature of the conversation. That is, for what purpose you are here, or understanding from the patient for what purpose he or she has come to you. Okay. In this case, if you look, greeting, of course, you have greeted the patient. This is the greeting. Then what? I'm Roshni, a nurse in the emergency department, which means you have introduced yourself. And then may I have your name? Because you don't know the patient, so you're asking for the name of the patient. And then what you say, okay, John, you look a bit uncomfortable. Now, where do I get this idea you look a bit uncomfortable? Because it is said in the scenario that the patient has a very bad headache. Now, from that, you can take the cue and you can initiate the conversation so that the patient, you build a rapport with the patient. So the patient feels that, okay, the nurse has judged my condition rightly, and that actually, helps in prompting the further conversation. So you look a bit uncomfortable. Could you please tell me what brought you here? I'm here to listen and help however I can. So you're stating why you're here. You are asking the patient first to tell why he is here and whichever way in which you're ready to help the patient. That's how you build the rapport. Initiating the conversation. Now again, initiating the conversation in the right way has an implication on your speaking score. Which criterion? Of course, it is the relationship building. One of the main aspects that comes under relationship building is initiating the conversation in the appropriate way. Now, to initiate the conversation in the appropriate way, you have to have a clear understanding of the scenario or the background of the patient. Depending on the setting and the scenario, you have to initiate it in the right tone. Okay. Now, see another variation which I have shown here of initiation. Is it right for this specific setting? Hi, I'm Roshni, a nurse in the ED. How's your day going so far? Can you even think of such an initiation for an emergency department triage? No. Now, like this kind of introduction, where can we use it? Probably now, if you are visiting a patient in the hospital ward, yes, that's fine. In that case, you don't have to introduce yourself, but this you can ask. Stating the nature can be fine, or greeting can be fine. How's your day going so far? You understand? So depending on the setting and the scenario, you have to start off your conversation rightly. Now, these two are two important factors that students don't pay much attention to, but they are very, very important in deciding your score because they have direct implications on the speaking assessment criterion. As you have seen in factors like intelligibility and in relationship building, these two aspects play a major role. Now, once these two are done, then what you have is pretty much straightforward, which you would all be knowing, but still we'll quickly analyze it. The task. You have the set of tasks here. Now, when you are reading through the tasks, what you have to understand is that, like in some task points, you will have to give out information, and in some you will have to gather information. Now, you have to clearly understand what the task is all about, and accordingly you have to decide what verbs you have to use. We have something called as the action verbs, which is nothing but these starting words which you see at words which you see at the beginning of each task. Now, they are called as action verbs, and these action verbs decide how you have to phrase your sentences. It's according to these tasks that you have to develop or construct the sentences that should be put forward to the patient. Now, find out means you have to ask a question. What you have to ask? Why the patient has come here. And throughout the conversation, no matter what the age of the patient is, you have to maintain a very polite and respectful attitude, and especially if it's an elderly person, you have to be more careful. Then ask how long the patient has been suffering. Again, ask. So it's a question. You can put a question mark there. Then find out more about the patient's symptoms. Again, it's a question. Then check what medications the patient, again check what medications the patient has taken. So again you have to ask that. Then ask whether the patient has seen a doctor before regarding this. Again, a question. Then comes explain, which means that here you're going to give out information. All these, for the rest of the points so far, you were gathering or collecting information. Now explain. What you have to explain? Just see what you have to explain. The risks involved in self-diagnosis or self-treatment. So randomly you cannot explain that, okay, now I'm going to explain to you, or now I'm going to give you ideas on what are the problems associated with self-diagnosis. Can you do that out of the blue? Can you do that? No. So definitely before that, you will have to ask some question to the interlocutor or the patient. So before this, probably you will have to put in a question, and based on that response, you will be giving out this explanation. So these tasks, or the words in the task, will actually help you in anticipating what you might hear from the interlocutor. When you see explain the risks involved in self-diagnosis or self-treatment, what you can expect? You can expect that the patient might have tried out some medications on his own, and already we have seen in that background information that over-the-counter medications has been ineffective. Okay. Now the next point, emphasize. So this is again not gathering information, you're giving out something. Emphasize the importance of getting a confirmed diagnosis, which means that you're stressing the need or necessity or importance of getting the diagnosis confirmed by a doctor. Now this is how you have to understand, how you have to construct the sentences. Now find out the reason for the patient's visit. We have already said that, like you ask to the patient why he or she is here, but in a polite way. Okay, together with the introduction, initiation itself, we'll be putting in this question, like we have seen in the previous screen, right? Like, I'm so and so, one of the nurses in the emergency department. May I have your name, please? You seem to be a bit uncomfortable. May I know what brings you here today, and I'll help you in whatever way I can. So you have asked the question there itself. Now you got the reason. So the patient would have said that, like, I have this terrible headache, and now you start gathering. This is information gathering. You ask for details like how long the patient has been suffering from the headache, and if they suffer from headaches regularly. Now, while asking questions, one thing that you have to keep in mind is that always start with open questions and then move on to closed questions. Okay? You allow the patient to express himself or herself fully. Don't restrict them to give just an yes or no answer. So you can say in this situation, probably you can say that, okay, so I would like to get a better picture of your headache. Could you just explain to me more about the nature of your headache? So like if the patient says that, like, I'm not clear with the question, could you please tell me what exactly are you looking for? Then you can specifically say that, okay, then tell me, like, how long have you been suffering from this headache? And then, okay, do you get such kinds of headaches regularly? You can put those questions separately. Then after gathering the information, like, you thank the patient. Okay, thank you for sharing those details. I have few more questions. Shall I proceed? Whenever you're asking questions, take the permission of the patient. And then, okay, again, more about the symptoms. Okay, Mr. John, could you explain more about the symptoms that you have been experiencing? And then you're allowing the patient to express all the symptoms that he or she has been experiencing, and they list out all the symptoms. Now, just in case the patient has mentioned only about, okay, the type is mentioned, where the pain, the location of the pain, the patient says, and the patient says about the sensitivity to light and sound, but the patient has not mentioned about nausea and numbness. You assume that the patient has not mentioned about these two symptoms. In those cases, you can specifically go for this close-ended question. Okay, so you say that, like, you have very sharp pain, then you have pain on your left side, and you are sensitive to light and sound. Am I right, John? Yes. And then, like, okay, I would also like to know, apart from this, do you experience nausea? Then they say yes or no. Okay, any sort of numbness or tingling sensation in your arms or legs? If they have missed out any of the symptoms given here, then you can specifically go for close-ended questions relating to those symptoms. Other than that, initially always start off with open-ended questions. Okay, you have gathered ideas regarding the symptoms. And then the next idea. Now you have to check what medications the patient has taken. So now how will you switch over from this to this idea? You can say that, okay, now, okay, I've got an idea regarding the symptoms that you have been experiencing and how long you have been experiencing it. I would also like to know whether you have taken any medication for the pain that you have been experiencing. Then the patient would say yes, and okay, if the patient has just mentioned, yes, I take medication, Then you can add on by saying, okay, John, I would also like to know how much you've been taking that medication and how often have you been taking it. Okay, so all the points are given here inside the bracket. The only thing that you need to keep in mind is that you should not be just reading out those points, but using those cues, you have to elaborate or develop the sentences in a very natural way. Then ask whether the patient has seen a doctor before regarding this. So the patient just now mentioned what medication he has been taking so far, and then you are just verifying like, okay, John, did you see a doctor before you took this medication? Then the patient would have given some response. And based on that, now you're giving your explanation. The risks involved with self-diagnosis. Okay, I understood why you have taken that medication without consulting a doctor, but I would like to enlighten you regarding the possible risks associated with such self-diagnosis or self-treatment. It can create a lot of unnecessary stress, and possibly in some situations your condition might not be really severe, but when you look upon online media, it might be portrayed as something very severe and that can cause stress, and it might also lead to taking wrong medication, which can result in some other further complications. I hope that is clear, John. Okay, so you explain the possibility is that the patient would have taken a medication without consulting a doctor. So you explain to the patient what is the importance of what are the risks associated with such self-diagnosis or self-treatment. And after that, again, you are emphasizing the importance of getting a confirmation from the doctor, which means that even though you have explained the risk, the patient would have demanded something else. Maybe the patient would have said that, okay, that's right, I understood the risk associated with the self-diagnosis, but I want some stronger medication to get over this condition. So for that probably you would have just stress this point again. That is, see, John, I understand the pain that you go through, but it is very necessary, or it is important that the doctor comes and assess your condition, and then according to your condition, according to your diagnosis, the doctor is the right person to initiate the treatment. I'm sorry that I cannot prescribe any medications, only the doctor can. So that is how you have to build the conversation. So pay close attention to these action verbs and decide or get familiarized with the kind of verbs that you can use for each of these action verbs, and we have already done a video based on that, so you can go through that. And this is how you need to do your role play. Now during the 3 minutes of preparation time, again let me summarize it. That is, it's not just about the task, it's not just the task that you have to focus on. You have to get a clear picture of where you're going to stage this role play and what is the state or the status of the patient that you're going to interact with. That is the opening to the role play. You need to have a good clarity on these two aspects. Only then get into the task. Dive into the task, read the task point by point, and underline, like whichever you feel you have to put forward a question, make a marking accordingly, and wherein you have to give information, put a mark accordingly, and that's how you do the appropriate marking on the role play card. And during this 3 minutes of preparation time, if you have any doubts related to any words, you can feel free to ask to the interlocutor regarding the same. So I hope this analysis of role play have given you an understanding of how to approach role play card. And next time when you do your role play card, please do bear these points in mind and do your speaking in a very effective and efficient way. We'll be back with more such videos. Stay tuned. Thank you.
Medcity International Academy. Trusted hands forever.